Okay, doctor.
Yes, Louis.
Hi. Good afternoon to all. Good afternoon to all the patients or public. And today we are going to start live. On our topic today. But before we start further, I'm going to introduce our speakers today, and he is Dr. Ong Hian Choon. Dr. Ong practicing in our hospital KMI Taman Desa as well as Hospital Pantai Medical Center, and he works previously in UMMC lecturer and also in UKM associate professor. He has lectured at numerous scientific meetings, courses, workshop, etc., locally, regionally, and internationally, and he still does it. He is also a medical legal consultant since 1993. His main interests are in reproductive endocrinology, especially menopause and CIN diseases. He is also a trained colposcopist and cryotherapist for the cervix, and he is also a certified menopause consultant. Today's topic is in conjunction with our World Cervical Cancer Awareness Month, and he is the right person. He is very knowledgeable on this particular topic. So without much ado, the floor is yours.
Uh, Thank you very much, Ms. Louis, for that kind introduction. Um, I believe that this topic on cervical cancer overview is very important. And in the time I have, I hope to just share with you actually what is cervical cancer. And most importantly, I would like to explore ways of how we can actually try to prevent this cancer from occurring in the woman. So let me now just go to my slides. Can you see my slides, Louis?
Yes.
Okay. So let me just start now. Okay. That's me as introduced by our marketing manager, Miss To Louis. First of all, I'd like to explore actually what is the cervix. Now, this is a diagram showing the uterus. This is the uterus. And that portion down there is called the cervix. Now, it is actually a structure by itself, starting from the internal os and then ending in the external os into the lower part called the vagina. Now, if you look, therefore, there is a canal called the endocervical canal, and this is what we call the ectocervix or the outer cervix. The difference being that actually in the endocervical canal area, the lining is different from the ectocervix. And so therefore we have to be very careful at which side we are talking about. Okay, this is a picture of a normal cervix, and this is a very bad angry cancer in the cervical region, destroying almost the whole cervix. Now the first thing is to ask ourselves, how does cancer of the cervix occur? Briefly, a normal cell of the cervix can change into precancer, and if this is not checked, this can change into cancer. So this is a very simple, what we call pathogenesis of how cancer of the cervix can happen. Now, in our sort of what all the studies currently show that the main culprit in causing this change is HPV infection by the human papilloma virus infection. Now, what is the human papilloma virus? In short, we call it HPV. This is a virus. This is the virus, okay? And frequent question asked about from patients to us is that if I have HPV, does it mean I will get cancer of the cervix? A simple answer is no. In most of the cases, the HPV may go away, but in those with persistent HPV, the risk is there. That is of getting cancer. How common is HPV? Well, the lifetime risk, according to the US CDC Center, says that most sexually active men and women, at least 50% of them will already have HPV. And actually, by right, in most studies, it says that more than 70 over percent of sexually active women actually by the time they are 18 to 22, they would already have HPV in their cervix. This is how common HPV is. Now, a little information about cancer of the cervix. Worldwide, there are so many cases per year actually, and basically almost 1 million cases per year are found. That this is what we call new cases, and about more than 250,000 deaths occurring from cancer of the cervix. And basically, you will find that actually the years of life lost due to this cancer can be even more than these various conditions taken in altogether, even more than AIDS and TB, etc., etc. So it is not a cancer that actually is not important. It is very important for women. In Malaysia, these are our statistics, but basically, if you look carefully, you will find that the lifetime risk for this cancer is actually about 1.1%, which is here. Okay, one around in the sense 1.1%. Okay, and if you look at the spectrum and profile of cancers in the female, the breast is still number one. And then we go to the colorectal area, and then basically you will find that actually the cervix is not that high, okay, in this area. So that there's the ovary and then the cervix. Now, if you look at world instance, same thing, that actually the cervix cancer comes at somewhere in the lower part of the statistics. So therefore, it is not the most common cancer. In women, breast is still important, and colorectal cancer is very important, and so is ovary. And here, the number of deaths, luckily, while deaths from other cancers are very high, if you look at the cervix, you can find that actually it is still quite in the lower region. So it means that actually in most countries, cervical cancer can be very effectively taken care of. And I would like to propose later for you how you can prevent it. And therefore, we can reduce the incidence and the mortality from cervical cancer. Now, in Malaysia, we are aware that basically the Chinese are the ethnic group that's more prone to cervical cancer compared to the Malays and the Indians. And the majority of women who get cervical cancer are in the older age group, over 45. So these would form, in a sense, high risk groups for screening. Now, in this is an old slide, but it shows that in Malaysia, the cancers mainly occur in the older women. You can see here older women, all right? But in a local study that we have done, we have seen that actually the Chinese are more prone over the Indians and Malays, and the average age is about 47.3, and basically it occurs in the lower social classes, and it is linked to a younger age at marriage, meaning that actually the first time of intercourse. So actually it's the age at first intercourse that is very important. How do you know maybe whether you have cancer of the cervix? So we look at the possible symptoms. First group would be abnormal vaginal bleeding. Bleeding can be in between periods. That means you have your period, before you have your next period, you have bleeding. Bleeding can be with intercourse, we call this post-coital bleeding, or bleeding can be after menopause, we call this post-menopausal bleeding. Then, women can have unusual vaginal discharge. Usually, it could be just yellowish, dirty looking, like pussy, but foul smelling. There is a certain sort of smell with it that it is not very pleasant, and if it's blood stained. So any woman who has blood stained vaginal discharge must be careful that we are not dealing with a cervical cancer. There are many other minor symptoms which are not so important, so we don't want to really talk about it. But I want to stress that women with cervical cancer in the early stages may have no symptoms at all. And that is the most important message I want to put across now. Okay? All right. Now, what are the risk factors for cervical cancer? So, if you are in the risk group, then screening becomes highly important. Sex is the most important aspect. So, the late Sir John Stallworthy, the Queen Mother's gynecologist and one of our most famous gynecologists in the UK, says that when a woman starts having sex, she not only gives up her virginity, she also gives up her resistance to getting cervical cancer. So sex is the main issue. The next issue is after sex, they might get HPV, human papilloma virus. And this is the precursor or the initiator of the change of the normal cell into the precancer and cancer cells. So let's say a few words about HPV. I use the word HPV, I already told you, it stands for human papilloma virus. Who are at risk? Basically, women who are sexually active. More importantly, women who have had more than one sexual partner. And even equally important is women whose partner or partners have had more than one sexual partner. Now, this part of the history sometimes is very difficult to obtain. I know that because I see patients like that, and the women will not admit, and the men will not admit too. So it's a very difficult, but you know yourself. So therefore, you should realize that if you are in this profile, you are at higher risk. We also know that women with special immune problems, but this is a small group, so we are not so particularly interested in them. So we are interested in the groups, what we call occupational hazards, uh, increased risk of HPV, prostitutes, social escorts, massage girls, etc., etc. And I've already mentioned just now multiple sexual partners. Women who have got sexually transmitted diseases are at higher risk. And of course, if you have a previous history of CIN, you're also at a higher risk of HPV. Okay. We also are aware that certain other areas, for example, slip there. Those who smoke and those who are taking the oral contraceptive pills may be at higher risk, but I would say that these are cofactors rather than risk factors. So I'm not particularly sort of concerned about this at all. What test can you do to find out whether you have HPV? That's the first thing we are talking about. Okay, very simple. You see, HPV testing is available in our hospital and in many other hospitals. So what people do is you can take a specimen from your cervix using the special brush like this one, and the specimen is dipped into a medium, into a bottle, and this will be sent for liquid-based cytology or LBC and HPV testing. We use what we call the HPV DNA genotyping. Yep, and can be sent to a lab. This is one of the labs that we send to, and so we make a special request for HPV testing and LBC together, and the results will come out as to whether you are positive or you're negative. The next thing we should test is a pap smear. I think most women know what's a pap smear. So it is a smear taken from the cervix. We take the smear from the cervix. We use an instrument here called the vaginal speculum, and through the vaginal speculum, we take a smear, and that means it's just a scraping of the solution of the liquid with the cells, and then we send it to the lab for testing. So that's called a pap smear. Who needs to be screened? That means doing the pap smear. Of course, uh, basically all women, but selectively all women who are sexually active should be screened with the pap smear. Also, these groups of women sexually active on the occupational hazards, same thing, multiple sexual partners, and those with HPV infections to see whether the HPV has already changed the cell into any suspicious cells. Those with STD infection, history of CIN, we also recommend that after delivery, women should be screened, and especially those women with a very strong family history of cervical cancer. So these women should be screened with the pap smear. And definitely, if a woman complains of postcoital bleeding, like what I mentioned earlier, foul smelling vaginal discharge, blood-stained vaginal discharge, irregular vaginal bleeding, and postmenopausal bleeding. So these women form a very, very sort of important group for screening. Now, the question asked frequently from patients or by patients, I feel fine, so why do I need a pap smear? Yeah. Well, a simple explanation will be that a pap smear can find treatable changes of the cervix, for example, precancer, before you even have any symptoms at all, and before you even notice a problem. So we are not waiting until you have a problem and then only we do the test for you. We want to do the test and screen you. Now, once a problem is symptomatic, it is much harder to treat already because if you already developed precancer or cancer, the disease may be more advanced. So, the earlier you screen, the better you have a chance of saving yourself against cervical cancer, which I'll mention in a little while. Okay, all right. Now, so remember this thing. Remember this thing. Women may not have any symptoms at all of precancer or cancer of the cervix. Now, a few points about screening with the pap smear so that you are aware. Basically, the sort of policy is when a woman reaches the age of 18, and especially after the first intercourse, we start screening. I already mentioned to you what Professor Sir John Stallworthy said. How often to screen? As a principle, in those who have not reached menopause, we screen 6 monthly, and in those after menopause, we screen once a year. This is a safe protocol for women. All right, and it's up to you to follow it or not to follow it. But this would be what we want to do. Now, the reason for us going nowadays 6 monthly instead of the older concept of annually is because we are not interested in picking up the cancer. We are more interested in picking up the pre-cancer stage. Because if we were to treat a woman in the pre-cancer stage, she will not develop cancer. Is there an age to stop? For current advice and policies, no. There is no age limit. Uh, Let me inform you that the oldest patient in the world found to have cervical cancer, she was 78 years old. When I was a medical student, I remember that my professors used to tell us that normally after the age of 60, there's no need to screen the woman. But since more and more women over 70s have been found to have cervical cancer, now the age has been extended. There is no limit anymore. Please remember that. Please. You can see that actually we are far away still from screening. You can see in this is 2019 statistics showing that actually only 4 in 10 women have been screened. This is very, very low pickup and screening program. We are still not very effective. Now, when we screen, then we basically most people previously used the Pap smear technique to report, but nowadays we have actually a different technique. This one we actually basically call it the Bethesda technique, which seems to be much better, telling us what we have a low grade lesion or high grade lesion, and that will give us a better indication to do further investigations. Okay, and so this is what you may have in your pap smear. We call it the cytology report better, not the pap smear. So one of the report is pap smear. Now, your smears may be abnormal, okay, and this is by the pap smear classification, and this is by the Bethesda classification. So if your pap smears are abnormal, then it's very simple. Basically, you do a HPV testing. You have not had it done. Secondly, you may want to repeat your smear maybe 3 months later, but if you really have a persistent abnormal pap smear, then we will recommend you to go for a colposcopy. A colposcopy is an examination of the cervix by a microscope instrument as an outpatient. You don't have to be admitted. It takes only about 10 to 15 minutes if it's done by an expert colposcopist, and then you'll be told about the findings. So we recommend, and I recommend that actually if you really have a significant abnormality in your pap smears or in your cytology smears, then you should go for a colposcopy. Other reasons for colposcopy includes those with persistent HPV infections. That means your pap smear is normal, okay, or a very unhealthy looking cervix because you may not have taken the pap smear from the correct area, or you have persistent postcoital bleeding. That means we must have missed something in your cervix. This is what we do in the colposcopy. We put the patient in a special position, and then we use an instrument called a colposcope to look into the cervix. Let me show you. And wherever there's any abnormality, we will do a biopsy. This is what we call a very directed biopsy. We are not doing it blind. I think blind biopsy should not be done anymore by any gynecologist. We should do a directed biopsy at the area where there's an abnormality. Then at least the yield from the biopsy will be much, much better. In KMI Tamandesa Medical Center, we have a special room available. This is the waiting room, and this is the treatment room. And we have our own system, our own colposcopy system available. So therefore, we can do colposcopies anytime as for those women with the indications I've just mentioned. This is a colposcopic picture of a normal, healthy cervix, nice and happy. This is a picture of an abnormal looking cervix. We call it angry looking. You can see all the abnormal changes. Okay. When we do a colposcopy and we do a biopsy, the reports will come back and you may fall into one or three categories: normal, CIN, or you have cancer. This will be the final results. When we look at so-called CIN, so pre-cancer, the old terminology is called dysplasia, but currently we use the term CIN, cervical intraepithelial neoplasia. We divide into 1, 2, and 3. Now, for the treatment of precancer of the cervix, we have various modalities available, and in KMI Tamandesa Medical Center, we are mainly concentrating on cryosurgery or radical electrocoagulation diathermy of the cervix. When we didn't have all these available expertise, we used to do cone biopsies and hysterectomies. So the aim of the modern treatment is to go away from the radical therapies, because nowadays precancer of the cervix affects more the younger women, and we cannot just be simply cutting out their cervix too much or just removing the whole uterus for them. We have to find some other modalities. And in my experience, this modality would be one of the best available for women with precancer of the cervix or CIN. We also do LEAP, and of course, laser therapy can be done, but we don't use the laser very frequently because we find that this simple diathermy technique is sufficient, in fact, more than sufficient, for the treatment of precancer of the cervix. Now, just 1 or 2 words about cancer of the cervix. You see, if you have cancer of the cervix, then we have to stage you. That means we go through to see whether are you in stage 1, 2, 3, or 4, right? That means stage 1 is the earliest, stage 4 is the sort of advanced cervical cancer. And why do we want to do this? Because you can see that if we treat a patient with cervical cancer, if she is in the earlier stages, the survival is so much better. If you come in the later stage, the survival is so low. And still, we try our best to do it for you, but we hope not to see any more cases of cervical cancer if possible. But we hope that if we see, we want to see them early, because then early detection can save lives. We can still successfully treat cervical cancer. So, how is cervical cancer treated? Just to give you some info, there are so many ways of treatment, but basically, in those that we see, they are already in the later stages of cervical cancer. We may have to do a hysterectomy. In this case, we call it a radical hysterectomy and lymph node sort of sampling. And then maybe we may have to combine with radiotherapy or chemotherapy. I will not say so much about all these things because our hope is that actually we don't see any cervical cancer anymore. We should catch them when they are at the stage of precancer. So I come to the most important part of the lecture. Can cervical cancer be prevented? This is a question that you all should be asking the doctors, because I think we have progressed so much in our medical knowledge and skills and treatment. We can, at this stage, prevent cervical cancer. Let me share with you my thoughts about this. So, I would say that cancer of the cervix is a preventable condition or disease. Now, how can you lower your risk? You can delay onset of sexual activity, but that is your own choice. But medically, yes, this is one way. You should know your partner's sexual activities. This is very difficult. Try not to smoke too much because some people, I already mentioned just now earlier, smoking could be a co-factor. Maintain a healthy and diet and lifestyle to keep yourself healthy and improve your body resistance to HPV infections. Practice safe sex. Maybe if you have multiple sexual partners, better make sure your partners all wear condoms. But you should actually get your pap smear and maybe your vaccine done to prevent the problem in your later life. Now, there is no cure for HPV. I must stress that point, okay? But we are very, very, very well aware that vaccination is successful. That's why a vaccine is needed. In our hospital at KMI Taman Desa Medical Center, we have a so-called colposcopy displacer service. And one of the things that we offer would be HPV vaccine, right? Okay. Now, when you take the vaccine, it is hoped that you will not get the HPV infection. And when you don't get the infection, then you don't get precancer and you don't get cancer. Very simple sort of a protocol. In Malaysia, since 2007, a primary vaccination program has been done for young girls in school, aged 13 years. And we have achieved quite a lot in that time. But those who are outside of this group of 13 years, then you have to seek your own vaccination because the government still gives free vaccinations for HPV for the 13-year-olds only in Malaysia, okay? All right. This is the current vaccine we are using, which is the latest available and the best, okay? It's called Gardasil 9. So remember that term, okay? And why Gardasil 9? Because it protects against 9 subtypes of the HPV virus. Now, even though we have this vaccine, we are aware. Now, this is a profile of HPV sort of infections in Malaysian women conducted in one of our major hospitals. And you can see that the blue lines means that actually we have still not covered these subtypes because the 9 Gardasil 9 only covers the yellow ones but not the blue ones. And if you look at the patients with CIN, that means precancer, still one of them is not covered, but the majority are covered. And of course, in those with cervical cancer, these 3 are not covered, the rest are covered. But basically, the major subtypes are covered by Gardasil 9, and therefore you get quite good effective protection if you take the vaccine. So, the vaccine protocol, many studies have been done and indicate that those between 9 years old to 45 years old can take the HPV vaccine. Currently, we are using Gardasil and mainly given in 3 doses at the start, after 2 months, and after 4 months. That means 0, 2 months, and 6 months. So in 6 months, the 3 doses are given, and the woman is then protected against the HPV infection. But if you look at the available, sorry about this slide, I don't know what happened. These are the CDC guidelines given as to how to give the schedule, and this will be actually advised to you by your doctors and in consultation with you. But for children, we do recommend a two-dose regime, which is taken once and then 6 to 12 months later for those less than 15 years of age. Now, it is been mentioned that actually, if you look at the group between 9 to 28 years, and you those who really have not had any sexual intercourse, especially, then and those who have not had any HPV infection, the rate of effectiveness of the vaccine can be up to 98%, usually more than 90%. If you look at the group between 29 to 45, the rate of effectiveness can still be up to 90%. So it is still very high protection. And in a small group, age 46 to 55, there are few studies which indicate that the effectiveness can be up to even 80%. While in my experience, my patients tell me it's still quite high, so they are quite happy to take it up to the age of 55. So in our center, in KMI Taman Desa, in our efforts to try to prevent cervical cancer, we have HPV testing available. We offer pap smear screening, especially LBC and HPV DNA typing. If there are any abnormal smears, we have the facilities for colposcopy and for biopsy. This is what we have in our own medical center. With a vaccine, we hope to prevent infection and therefore, as I said earlier, to prevent pre-cancer changes. And also, if we treat pre-cancer, then we can prevent cancer. And we have the treatment facilities in our hospital, as I had mentioned much earlier in my slides. Now, I want to mention one last point. This is a very simple thing that people talk about: chronic infection of the cervix, or what we call chronic cervicitis. It sounds so benign, it sounds so simple, and many gynecologists just couldn't be bothered about it, actually. Now, it has been said that actually chronic infection of the cervix with, with prolonged sort of irritation of the cervical lining may also change the lining from a normal to precancer, and then, if not treated, to cancer. So I'd like to say a few words about this infection. Here you can see chronic cervicitis, very angry looking. It is typical, actually. These are what we call the Neboden follicles that happen on the thing. So this typical picture is obvious. This is the picture of chronic cervicitis. We have actually this technique has been developed a long time ago for the treatment of chronic cervicitis. It's called cryosurgery. Cryosurgery means cold surgery using nitrous oxide gas. And we have this available in our medical center. This is the probe that we use, apply to the cervix. This is a model, apply to the cervix, okay? And then we freeze the cervix with nitrous oxide gas. Now, in my experience, one treatment of 3 minutes gives you up to 98% cure rate. And the important thing is that this is a painless outpatient procedure. It only takes less than 5 minutes, and the chronic cervicitis can be taken care of. And as I said, up to 98% cure rate. Therefore, in my opinion, based on my experience, if you can treat chronic cervicitis with cryosurgery, then you can break the chain, and therefore the patient does not get precancer and she doesn't develop into cancer. So think about it. This is another option available to women. Now, in trained hands, actually we also use cryosurgery for what we call focal CIN1. That means it can also be used for precancer, but only if you establish that is focal CIN1 and not more than that. And you can achieve a success at preventing cancer of the cervix. So I think the strategy now, so to just to sum up, the strategy for prevention of cervical cancer is, as I mentioned, vaccination, that's one. Two is treatment of CIN, that's two. Okay, and also treat chronic cervicitis. Don't be too complacent about this condition, even though you think it's purely and perfectly benign. Don't treat it. And cryosurgery is a very safe, painless outpatient procedure. Takes less than 5 minutes. Now, the World Health Organization has targeted for 2030 various strategies, and you can see here that 90% of girls fully vaccinated. We are almost achieving it in our girls, our 13-year-old girls. But what about those ladies who are over 13, those young women over 13, and those older ladies over 13? We don't have the figures in our country for that. WHO also aims that actually 70% of women should be screened with a good, significant, accurate testing. And basically, we offer the conventional pap smear, and if you want more sort of accurate, so-called more accurate test, we can use liquid-based cytology or LBC. And definitely, you may also want actually to screen yourself for the HPV DNA, which can be done very simply. And we hope that actually WHO hopes that at least 90% of patients, uh, if they develop pre-cancer or cancer, they would have an avenue to a very effective treatment. This is our hope for the year 2030. So I put it to you, ladies, cervical cancer can be prevented. With that, I would like to end my lecture, and I hope that I have given you enough thoughts. Number one, what is cervical cancer? Number two is who are at high risk. Number three is actually what tests can be done for you. And number four is our hospital does offer you all the modalities for counseling and investigations. And if you do really have pre-cancer, don't get so worried. We can treat it for you effectively with the treatment modalities that we have. And lastly, even if you have cervical cancer, we can offer you effective treatment. Thank you very much.
Thank you, Dr. Ong. As usual, your slide is always very comprehensive and it's a very solid presentation. Okay.
Thank you.
All right. I think we go on with the Q&A session. All right. I have prepared a few questions here. First question, because in your presentation you mentioned that of course the moment when the women actually started their sexual life, they are putting them on the risk of getting cervical cancer. Can actually a virgin get cervical cancer?
Uh, the answer is yes. Because you see, the things that, as I mentioned earlier, there are two types of cells. Okay, uh, the endocervical canal has what we call endocervical epithelium or mini columnar epithelium. The ectocervix has got squamous, we call it stratified squamous non-keratinized epithelium. Now, cancer can develop in the columnar epithelium without HPV provocation. But luckily for women, endocervical cancer of the columnar epithelium type is very rare. So to answer your question, yes, They can have
That
it
is
if
right.
they have that, but it's rare.
That
It's
is
rare.
right. Okay.
Most the almost all of the cancers that I've seen in the cervix is actually stratified squamous epithelium,
Mm,
not endocervical. Okay.
I see. Okay. Okay. Question number two is that you did mention just now is that for women, it would be better. You actually recommend to actually go for the pap smear test every 6 monthly. What about HPV DNA test? How frequent that it has to be done?
I think HPV testing is optional, optional. Because to me, the most important thing is pap smear. Now, if I although I did put it in the recommendation, if I were to find an abnormal pap smear, say I will not force the patient to do HPV DNA genotyping. But for the woman, if I were a woman, I would go. And if I were to go for HPV, I'll do it once. And if I'm quite sure that I don't have multiple sexual partners, and if I'm quite sure that my partner has no multiple sexual partners, I think once is sufficient. But if you are not sure, then I would say it's nothing wrong even if you want to do your HPV testing every year, for example.
Okay.
It is feasible, it's not so expensive, and I think it will be wiser.
Okay. All right. Uh, this is my third question. What do you think of the role of HPV vaccine for patient above 45-year-old? And that's because the question is related to because many as far as we know, WHO has the guideline has says that HPV vaccine is for those below 45 and below. What is the role for those above 45?
Yes, I have discussed this earlier in my slides. You see, I have been made aware of about two or three studies who actually studied women over the age of 45. That means in the age group 46 to 55, and they were tested, they were given the vaccine, and they were actually assessed years later, and I was shown all the statistics of that investigations. And as I said just now, the protection rate is 80% compared to over 90% in the younger age group. See? Now, for me, in my practice, I tell my patients, most of the CIN women are now very young. Uh, uh, the youngest patient I have seen in my clinic with CIN, she was 16 years old. But she told me she started having sex when she was after 12. That's what she told me, okay? But you take an average, the CIN women will be around 40s, for example. And then the cancer women is over 45 to maybe 55 or so like that. So there is a role for women after 46, after 45, that means 46 to 55, to also take the vaccine, you see, because that will still protect them against HPV infections and cervical precancer and cancer. But 80%, which I think is still high,
Yeah,
80% is still
still
high. Yeah.
correct. What is your opinion about HPV vaccine for men?
That is a $64 million question. Well, I mean, let's be frank, like, scientific studies have indicated that the HPV virus causes a lot of warty lesions in men.
Mhm.
Okay, and this can be very, very distressing and painful for men, equally for women, warty lesions. Now, we are also aware that there are some studies which indicate that men with HPV also have a higher risk of penile cancers, right? And therefore, when the vaccine was propagated for men, I fully supported it, honestly. But it has been so difficult to get the men to take the vaccine. Suppose the men, I mean, penile cancer is not very common
Yeah,
anyway,
yeah, yeah.
not very common. And so they say, well, I don't think I'll get it, lah, so no need for the vaccine, see? And also, while I see more women with warty lesions, I've never seen a man with a water lesion because probably they don't come and see me as a gynecologist. But
Yeah.
I don't know about other doctors, how often they see water lesions in men. But water lesion is not cancerous. So therefore, I think the men, because of that, they are reluctant to take the vaccine.
But for men, the vaccine is still 3 doses regime.
The same regime is used for men and women.
Oh, it's a this just
Same
the age
regime.
difference.
Yep.
Okay,
Yep.
all right. In your slide, towards the end of the slide, you did mention that for those women who have chronic cervicitis, so
Yes.
it would be better to go for the cryosurgery surgery. Now, is there any indication in the pap smear or the LBC result that indicates cervicitis?
Not
Or
really.
it has to be explored or detected during pelvic examination?
No. Most Most, if not all, the women with chronic cervicitis will have a history of chronic vaginal discharge.
Okay.
And you can actually, I got many patients in that category, and they will tell you, see that uh, I have this discharge. I went to see a doctor. He gave me some medication. I got better. Then a few months later, I get it back again, you know. And they even tell me they actually sometimes have seen gynecologists, and the gynecologist gives them some treatment, maybe vaginal medicine, vaginal pessaries, etc., etc. And they use the word, I get temporarily relieved. So the chronic vaginal discharge is persistent. Right. Now, in such patients, the first thing I would do is I will ask them, when was your latest pap smear done? If it's recent, fair enough. I'll look at the report and accept it, the report. Then the first thing I will do is I'll do a speculum examination if they allow me. Okay. I mean, I'm quite sure that most of them are actually sexually active already. So I'll do a speculum examination, and actually, with a trained naked eye, you can actually pick up chronic cervicitis on a naked eye, like the two pictures I showed. You can see it on the speculum examination. If you are not sure, no problem. I just do a colposcopy for them, and I will know that they have chronic infection. But the main profile of such patients is they have chronic vaginal discharge, and they have never been successfully permanently treated. This is what they want to stop it, you see? Right. So, in my experience with the cryosurgical treatment that I picked up when I was in Australia, I found that one proper treatment will stop the continuing discharge in at least 96% of women. But you must do it properly, yeah? So that is a technique you have to learn, and I was willing to teach people how to do the technique. And to be frank, I have presented my studies on this technique even in some international conferences. You see, so this is a very effective technique for these patients, because we used to believe that actually not only viruses can irritate the cervix. Maybe bacteria also can irritate the cervix and change it into precancer, is it? The normal cells of the cervix. So this is one condition I feel personally we mustn't be too complacent about and just ignore it. Okay?
Okay, all right. So, doctor, I have no more question. Do you want to give your advice to the women out there? about the awareness. I'm sure now most of the people would be aware that, they have to do yearly gynecology checkup, including a pap smear at least. But there will be no doubt there will be people who don't know about it. They don't know what they know to do. What is your advice as a gynecologist?
I think there are no questions coming from the public because I think I've made my lecture very simple, very easy to understand, so they
Yes.
all know what I'm talking about. Yeah. So I'm happy with that. Okay. Now, I believe in this concept. Prevention is always better than cure. I believe strongly in that concept. See, and this is one area in which a woman can help herself to prevent this terrible disease of cervical cancer. And I've already tried to sort of impact on the women that cervical cancer is preventable. So if I were a woman, number one, I wouldn't want to get cervical cancer anymore. So here we are to help you. So number two, many women are shy to see male doctors to get pap smears done. Never mind, there are female doctors available who can do it for you. So, but I think they should all get a pap smear done the moment they are sexually active. The moment they are sexually active. That's number one. Number two, the HPV vaccine is the first vaccine I know of personally that can prevent a cancer. Now, if I were a woman, I would tell myself I'm the luckiest sex. I'm luckier than men. I have a vaccine that can prevent me from getting cervical cancer. I will go for the vaccine, definitely. I tell many of my patients who have daughters, it is better to give her the vaccine now than to wait until you die and give her your property. I think you better protect her now. I think that's the best thing to do for your daughter, you see. So, one, avail yourself for regular pap smear testing. And number two, please take the vaccine. Number three, it is important for you to come for regular checkups. We offer in our hospital what we call a routine gynae assessment, right? Now, as part of the gynae assessment, a pap smear is done, right? Now, if you are a little bit more knowledgeable and you are a bit more worried, then add on a HPV testing earlier in your life once you have been sexually active. That's what I would say. And
Okay.
no need to get panicky about anything because sometimes when uh, a woman gets a pap smear report from a doctor, she's almost like so panicky that she thinks that she's going to die. I think you show it to one of us, and so that we can evaluate your report properly for you to tell you. Because many patients think that if they have abnormal pap smears, they already have cancer. No, no, it doesn't mean that.
Yeah.
Yeah, that's what I would advise them. Yeah.
Okay. Thanks, Dr. Ong, for your time today. And also thanks for the participants. So we will see you. Thanks, Dr. Ong. Thank
My
you.
greatest pleasure. Yeah. Stay safe. Stay away from cervical cancer.
Yeah, there's so many ways to prevent it. So no one should die of cervical cancer at this century. You know. All right. Thanks.
Hey, I'm a about you.